Hello, my name is Mackenzie Pearl, and today I'm going to be talking about mentorship and nursing leadership. So to introduce this topic, I would like to present my PICO question. So what I came up with is, with newly hired nurses, what is the effect of mentorship programs compared to workplace educational training on the quality of patient care within the first year? So the three course objectives from our syllabus that we will be adhering to is 2, 3, and 4, which states demonstrating nursing leadership principles to plan and implement patient safety and quality improvement initiatives within the context of a dynamic, complex healthcare system and interprofessional care, applying concepts of global health to plan appropriate, culturally safe care and health promotion for vulnerable populations. And lastly, to utilize the best current evidence and systems thinking to improve nursing and healthcare practices for groups or populations. The three outcomes that I came up with are as follows. 1, the student will correctly examine the standard teaching's impact on safety provided by a mentorship program. 2, following the completion of this presentation, the listener will accurately identify the standard characteristics of a mentor. 3, the student will analyze the differences in nursing practice from those without a mentorship program versus those who participate in a mentorship program. So let's dive in. Impacts of practice. Impacts of mentorship programs are beneficial for the mentor and for the new graduate student. So benefits for this mentor are: it increases their quality of care as they are providing care for patients alongside the mentee. They are monitoring patient safety and ensuring the patient is always provided safe care. They are able to exercise nurse leadership opportunities by overseeing other nurses, as well as keeping current with interprofessional practices to teach the mentee how to be a good nurse. For the new graduate, they also benefit from the mentorship program by learning how to provide safer care, having helpful oversight, seeking career advice from the mentor, as well as developing critical thinking skills and clinical skills to help their patients. Here's some quick stats. There's 4.3 million active registered nurses in the U.S., and we still have a shortage. The statistics from the source listed below states that first-year nurse turnover rate ranges from 13 to 35%. Of those, 66% report feeling burnt out. With the study that this source completed with a mentorship program implemented, their new nurses intending to leave their job without the mentorship program was 63%. After they implemented the mentorship program, it dropped to 47%. So that is significant, and that shows the strides that a mentorship program can make. Role and function of the nurse leader. So we have oversight of the mentor, assigning a mentor, assessing student readiness, and assigning length of mentorship, as well as assigning patients. So it is very important that the nurse leader is good at assessing how good the mentee is doing with their patient assignments, so that they can adequately introduce more jobs and more tasks for them to do, so that they are ready to be on their own by the end of the mentorship. Collaboration with nurses. There is many departments that must collaborate with the nurse to ensure that the mentee has a successful mentorship program, such as human resources, to make sure that the mentee is all set to be hired on once completed with the mentorship, as well as healthy. Managers, which oversee the entire unit, as well as supervisors. CNAs, which work alongside the nurse and can help alert to the nurse leader when delegation tasks are not appropriate, or when the mentee is doing a great job at delegating tasks, as well as physicians, since the nurse leader will be teaching the mentee how to communicate with them to seek out orders. Personal experience. So my personal experience from my mentorship program, I had 3 weeks of orientation and a 3-month mentorship program when I started as a nurse with my Michigan Health in Midland. My mentor her picture is on the screen. Her name is Sam. She did an amazing job of teaching me how to be a good nurse and taught me many critical thinking skills, which have helped me within my first year of practice. So much that I was asked to mentor a student myself recently. He already completed his orientation with me. His name is Chris, and he will start his mentorship with me after Christmas. Nursing organization meeting. So as the requirements for this project, I attended a med-surg manager meeting. Every morning they have this meeting so that all of the managers can stay on the same topic with what are the issues on their unit currently. There was a lot of transformational leadership that I saw. They were inspiring each other and giving each other ideas on how to help with certain situations such as staffing as well as nurse burnout. That was very effective, and the nursing supervisor oversaw the meeting, which helped with any points that they were steering off subject. There was a lot of new leadership in the managers anyways. My manager, as well as 2 other managers, had just been hired on. So it was very interesting to see how new managers versus old managers had their leadership styles. It seemed more top-down with the older managers and more transformational and inspiring with these new managers. So that's very interesting to see in comparison. In conclusion, mentorship and nursing leadership has a lot of impact on nursing leadership, as well as how nurses collaborate with other specialties in the hospital. I personally have been part of the mentorship program and feel that I have grown significantly from the mentorship in itself versus having had been thrown on to the unit to just figure it out personally. This is something that needs to be implemented more readily in hospitals, and I would encourage any facility to implement such measures. There are my references. Have a great day.